Have you ever wondered how doctors can tell if a tiny bacterium is causing your stomach woes? It is fascinating how medical science uses different clues to piece together the full picture of your health. When it comes to something like an H. pylori infection, understanding the tools available can make a big difference in getting the right treatment. An H. pylori blood test is quite accurate in detecting if you have been exposed to the bacteria at some point. It is generally very good at telling you if your immune system has created antibodies against H. pylori, indicating a past or current infection. However, its accuracy for diagnosing a current, active infection, especially after treatment, is limited compared to other methods. The reason for this lies in what the blood test actually measures. It looks for antibodies, which are proteins your immune system produces in response to an infection. These antibodies can remain in your bloodstream for a long time, often for months or even years, even after the H. pylori bacteria themselves have been eliminated. So, while a positive blood test reliably shows past exposure, it cannot definitively tell your doctor if the infection is still active and causing problems right now. This means that while a blood test can be a good initial screening tool, especially if you have never been treated for H. pylori before, it is not the best choice for confirming an active infection or checking if treatment was successful. For those situations, doctors typically recommend a urea breath test or a stool antigen test. These tests directly detect the presence of the live bacteria or specific proteins from them, offering a more precise snapshot of your current infection status. Understanding this distinction is key. For example, if you tested positive with a blood test and then received treatment, using another blood test to confirm eradication would likely give you a false positive result because those antibodies could still be circulating. This is why doctors relying on these more direct methods to ensure the infection is truly gone and to guide further treatment decisions, saving you from unnecessary worry or medication. Ultimately, knowing the strengths and limitations of each diagnostic tool helps you and your healthcare provider choose the most effective path. By using the right test at the right time, you can accurately identify and manage H. pylori, leading to better outcomes and relief from any related symptoms.